Here we go. Okay, happy Saturday, everybody. Welcome to AWC's Feature Friday on a Saturday. We had little hiccups yesterday, but here we are again, ready to present the topics of the day and introduce both Amina Haji and also Carmeleta McKinnis-Williams. And they're going to be talking about their work with the Austin Health Commons and some other work as well. Go ahead and introduce yourselves.
Good morning, Hasiel. Thank you for having us today. And good morning, Austin Wellness Collaborative. I wanted to start by just saying thank you to Ashley Maltz, Dr. Maltz, and all of the Austin Wellness Collaborative community, because you all are our first sustaining business donors for the Health Commons, and a small percentage of your membership fee goes toward sustaining our truth racial healing and transformation work, as well as our COVID-19 relief program. So thank you so much for providing that support. Today, we're honored and excited to share a little more about what we're doing and invite folks in. Carmeleta and I are going to give you just a little sense of what we're doing at the Health Commons in Carisha, and invite you to participate in an interactive panel with me, Carmeleta, and Danielle on the dates that are on the screen. Sunday, October 18th, which is tomorrow. There's still some space to sign up. Tuesday, October 20th at 6 p.m. or Wednesday, October 21st at 12 p.m. It's a 60-minute panel, but 90 minutes if you can stay. So for the introductions of ourselves, I'm Amina Haji. I'm a family medicine practitioner, a mom and social entrepreneur. I have lived and practiced in Central East Austin for the last 2 decades. I'm the founder, CEO for Carisha Community Center for Wellness, and the co-founder and executive director for Austin Health Commons. And I happen to run 5 Airbnbs on the side that help me, have blessed me with being able to have these startups and to transform the culture of health and healthcare in our community. So thank you, and I would love to gratefully have Carmeleta, my sister, introduce yourself.
Thank you, Amina. Thank you. Hello. Thank you, Jazz. I'm Carmaleta McKinnis-Williams, and I am the founder, principal, president of Proverbs 31 Consulting. And we are community engagement, community equity solutions, faith-based initiatives, and strategic business planning services. And we are very excited. I'm also a truth racial healing transformation practitioner, and we are very excited to join Austin Health Commons on the steering committee there, and other community groups to bring racial healing, racial equality, equity, and we are very excited about this forum today. Thank you.
Yeah. Well, and Jazz, you said then we just talk about what we're doing, right?
Yes, yes. Please introduce yourselves, and we're happy to have you here, and we're happy you're presenting for us.
So I guess when Carmeleta was talking, it came to my mind like, okay, so maybe the one approach is, what does racial equity consulting and what does a racial healing practitioner have to do with a medical doctor? Why are we paired together, sharing with the Wellness Collaborative and inviting the Austin Wellness Collaborative to be a part? So I think that would be a good place to start. And I'm going to share my story and how I came to this work. I'm a 4th generation medical doctor. My grandma practiced in India in the 1930s. She marched with Gandhi for the independence of India. And then she spent the last 30 years of her life in an ashram in the Himalayas, where I got to learn really deep spiritual connection as a child growing up going there. And my parents were doctors in Bryan, Texas. I got to see them unite community through racial healing. When I grew up in Bryan, it was a very racially segregated town, and it remains that way today. Austin is not very different. We have I-35 and a 1928 master plan that created a great divide where west is predominantly white and now some Asian, and east side is largely black and brown, though it's gentrifying quickly. So I have had the privilege to work in a lot of places and always realized that our healthcare system is separate but unequal. There's some places that I would work and say somebody has a cold and they're in 24 hours after they develop symptoms. But there's other places where I work where it's mostly black and brown, and somebody could be having a pneumonia and they're very, very ill, and they're just coming in because of the load that life has provided some people and the differential access. So we have segregation in our system. I think what this project is about, though, it's about addressing our whole health. So and changing our systems. When I grew up, I learned yoga when I was about 6 because my mom did it every morning and I wanted to be near her. And I got to learn food as medicine because we cooked in an Ayurvedic science of life method. So when I got to medical school, I was very shocked that that's not the paradigm for health and healing. And I know at Austin Wellness Collaborative, this is something that providers already know, that health and healing are more than your symptoms. So I went to medical school and residency here in Austin with a vision for how we can have whole health, address whole person health, but not forget whole community health. Because if all we do is find ways to address ourselves as whole people, our community is still segregated. We still have the kinds of statistics that a Black man lives on average 10 years less than a white woman, and lots of other numbers we can share. So without going on too long, I'm going to share what we're doing and then pass it on to Carmaleta. Is that okay?
Yes.
That sounds great.
That was a lot of background. So I'm going to use a couple of slides to just say what we're talking about. We're inviting you to be a part of a presentation. One of them is 2 p.m. tomorrow. And then a couple of others I mentioned that's called Flipping the Script, How Carisha and Austin Health Commons Can Help Heal Healthcare. So we know that the vast majority of health outcomes, about 89%, are determined by all kinds of things outside of clinical care. And clinical care only impacts about 11% of health outcomes. And yet we spend a vast majority of our resources on clinical care in the US. So we've created an all-encompassing system where there's a health center called Carisha that addresses whole person health. And it's nested in, stewarded by, held accountable by a community called Austin Health Commons. And that community is committed to truth, racial healing, and transformation. So we don't skip over the reasons why only some people right now can access holistic health care. The Carisha Community Center for Wellness is a 14,000 square foot health and wellness center that we're building in Central East Austin, East 51st and Springdale. Lots of people have seen the signage. It's been in creation for some time, and we will break ground very soon. And medical doctors like me will practice side by side with a range of holistic practitioners with lots of wellness offerings like mindfulness and Zumba and cooking and gardening, so that we shift from sick care, where we're prescribing a pill for every ill, to healthcare, where we're actually embodying a space that promotes health. And then the Carisha Center, like I said, is held by, nested within, and eventually will be owned by the Austin Health Commons. The Austin Health Commons is a 501c3 nonprofit. that's committed to a healthy, healed community rooted in love. And we do that in part through truth, racial healing, and transformation circles. And why we eventually want the commons to own Carisha is so that the profits of health and healthcare go back to community, to create more access, to help launch the next centers with the next providers, whatever that might be. So we know we cannot do this alone as health professionals. We can't do it alone, can't do anything alone as human beings. And that's where the partnerships come in. And that's where my amazing sisters and brothers who are our truth, racial healing, transformation practitioners come in to really speak truth to what's happening in community, and then build bridges among people who look different than one another and have been disconnected from one another. So Carmelita, would you be willing to share the role of racial healing and the commons in health and healing?
Well, absolutely. Well, there's statistics that show the trauma that affects us physically, emotionally, mentally, as a result of racism in America. And we know that truth racial healing circles provide us an opportunity. And in this environment, because of the pandemic, virtually, we get an opportunity to put people together to share their experiences, their stories, because we all have a different story. My story is not your story, and your story is not my story and experience. And so when we do the circles, we get an opportunity to integrate intentionally, right? We get an opportunity for me to hear your story. Some stories have pain, some stories have experience that wow, people have the wow factor. I never thought that. I never saw that. I never experienced that. And then they live your truth through your story. You live your truth through their story. We create a story together. And that's how community comes together. And it's so important and critical for practitioners and doctors and nurses and health practitioners to get in the community like Health Commons, like Carisha, to do the work, to roll up the sleeves and stop doing a lot of press releases and putting out statements, but really living and walking the talk and being a real change agent by integrating, interacting with each other. We're not going to change this world unless we do it together. And so I love what I do, because when we walk away, somebody is changed. Somebody comes and they leave a different way. And so I think that the human factor, there's one race, it's the human race, right? And we just tear down all those hierarchies and we pull it into humanity, commonality, community, relationships. And we build that through truth, your truth. And racial healing is when we come together, and the transformation happens when we leave the circle. It's the work that we do when we leave, right? So that's in a nutshell.
Yeah, and I do feel transformed every time I leave a circle, because I realize, I always realize, oh my gosh, it's always something about one of my biases and how I was looking at somebody before I came into that circle, before I talked to them and heard their story. And I think as healthcare practitioners, it's imperative, we're in reality that we're humans. We all have biases, and there's systems that were created in the US that were based on a believed hierarchy of human value. We can't get around that. That's what that course, Undoing Racism, teaches us. And there are theories about race deeply embedded in our psyche. So by coming together, we can break those down. And as healthcare providers, we have so much power over people's learning and health and choices. And so for us to break those, to get awareness of where those biases are and get awareness of what the world is really like for different people who look different than us, it's powerful.
Yeah, you're absolutely right. All the ideas are here, and I think this is, I see now why Ashley chose to support your organization because, as you know, the AWC, Austin Wellness Collaborative, we have very similar goals. Of course, not so much for the community directly, but inter-practice, with practitioners specifically. So, yeah, I love that idea and just kind of coming together and really becoming more accepting and loving of each other and understanding of our differences and coming together as a new community.
Yeah. And I imagine we have just a couple of minutes left. And so just chiming in from what you said, Hasiel, absolutely. We're in alignment with what Austin Wellness Collaborative does. And Ashley is a superstar at connecting people. And we have a motto, collaboration and not competition in health and healthcare for the well-being of all people. So what we are intending to do through Carisha and Health Commons is to provide a blueprint for how to make healthcare collaborative, meaning where practitioners are collaborating with one another in a structured way, business models that help us do that, where providers are collaborating with our guests or our patients or our clients. So it's not a one-way street, especially in medicine. We have an idea of authority of the doctor. And so that our healthcare delivery systems, be it a small practice, a big practice, are in collaboration with community. And so through that, we commit to our individual and our collective well-being, because you cannot have one without the other. And I believe we all believe in all of those principles. I think we don't have the blueprint. We don't have the path. We don't have the models. And we're busy enough in our lives to then not have to go figure out how to create it. And so that's what we're doing. That's what me and Carmaleta and Danielle Yanez, who will be there tomorrow, and all the other Carisha providers and community, we're creating it in real time. We don't know what we're doing yet, but we're doing it, and we invite community to be a part of that.
Yeah, it's amazing, and we're happy to be here too.
Well, thank you for being here. Thank you for this opportunity. Thank you for a way for us to connect to the community. This is awesome.
I'm gonna just go ahead and say, we invite you, the specific way that we're inviting our providers in our community to learn more is 3 different interactive panels. One, pick your choice. One is tomorrow at 2 p.m. It's on Eventbrite. You just look up Flipping the Script, or I don't know, right into the Wellness Collaborative. You can message A. Haji at austinhealthcommons.org for a link, or maybe Hasiel or Ashley. There's another one Tuesday, October 20th at 6 p.m. You can stay for an hour, though we recommend 90 minutes. And there's another one Wednesday, October 21st at 12. Once you're there, it will be an engaging, interactive, enjoyable time together to learn from one another and to co-create this vision to help heal healthcare. Awesome. If you'd like to donate to our vision, I will pull up that slide. If you don't have the time, we always welcome contributions. AustinHealthCommons.org helps us sustain the racial healing circles. Carisha.org helps us build the health center. We're also in the raising capital right now, the working capital for running the center. So email me or message, I guess, Ashley, if interested, and it'll get to me. Thank you so much.
Thank you.
All right. And I will put links up on the live video description.
Okay, yeah, that sounds good. And we always end with, I do, with saying namaste. And that just means I bow to the universal presence, the spirit, the earth, God, whatever it is, the universal presence that's in you, that's also in me, that is what connects us and makes us all one, like Carmelita says.
See you.
Namaste.
Thank you.